Hi everybody, happy Wellness Wednesday. It's November 4th. Christine Pluta here, Medical Director of Schuylkill Medical Associates, which is a concierge house call practice for seniors and homebound in Philadelphia and Camden County. So last Wednesday, I talked about what qualifies a patient to have a home visit. Today on Wellness Wednesday, I'm talking about this little gadget here called a pulse oximeter. Why you should have it, who should have it, how it works, etc. So this pulse oximeter is something that I recommend that all house call physicians should carry. I carry one all the time. Sometimes I carry two because I leave them in patients' homes. But this tells us how much oxygen is in our bloodstream. Any patient with lung disease or breathing issues should have this in their home. They don't cost more than $20-25 on Amazon. They're also sold in retail pharmacies. But yeah, I would not pay, I buy mine on Amazon and I would not pay more than $25 for one. But yes, they're a great little gadget to have in the home to help the patient with lung disease gauge their illness, and it also helps to give feedback to us. If you call us with an issue, I'll often ask, did you check your oxygen? What's your oxygen level? So this has, when you put it on your finger, there's a little infrared and a red light in there that detects the, it gives you the ratio of the oxygenated to deoxygenated blood in the bloodstream, but you don't need to know all that. So it tells us how much oxygen our hemoglobin is carrying. Hemoglobin is a protein that's in our red blood cells that carries oxygen throughout our body. A normal oxygen saturation in the blood is 95% or higher. Most people have 97, 98, 99. So if you put this thing on your finger, any finger, it doesn't matter. It works best when your hands are warm. It does not work well at all if you have nail polish on. So take nail polish off of one nail. It doesn't matter which hand. Patients with vascular disease or who have very poor blood flow in their hands, sometimes it is difficult to pick up. But yes, use any finger. There's a little button here that you press. The lights come on. I'm not sure if you can see this. And there are two numbers that will come up. One number is the heart rate. The other number is the oxygen level. So usually where the heart rate number is typically the one on top, it has a little heart by it. The other number usually it says O2 next to it with a percentage. That's the oxygen saturation number. So, looks like I'm not doing well here, but I am. Let me do the other finger. Okay. Come on. Okay, there we go. So if we look at the bottom number here, it says 98. Top number, it says 50, 56. That's my heart rate. So I've got a normal oxygen level. If it shuts off, sometimes you just have to adjust it. And like I said, anybody with lung disease should have one of these. Know what your baseline oxygen is. So if you have asthma, if you have COPD, if you have congestive heart failure that flares up a lot, know what your baseline is. Because when it flares, you're going to check your pulse oximeter. So let's say your baseline is 95% at rest. Get a baseline oxygen level when you are feeling well, not having any sort of flare-ups, and at rest. If you're having a flare-up, if you're feeling short of breath, if you're wheezing, if your ankles are swollen, if, God forbid, you think you might have COVID, these things are great to have for patients who are at high risk for COVID. If you're having a flare, check your pulse oximeter. Put this thing on your finger. If it's below your baseline, call your doctor. A lot of times It could just be something that needs to be tweaked with your medicine. Maybe you might need a nebulizer treatment, or maybe there's something worse going on, especially if there's a drastic drop. If you are feeling extremely short of breath, wheezing, etc., and you check your oxygen and it's in the 80s and it's pretty consistent with how you're feeling, that might be a 911 call. Maybe your doctor has already given you parameters for what to do when your oxygen drops. But nonetheless, these things are a great way to gauge if what you're feeling is consistent with a drop in oxygen. Again, I can't reiterate enough. Have one of these in the home if you are a lung patient, or a patient that suffers from any type of illness that causes shortness of breath or causes low oxygen levels. You can buy it on Amazon. You can buy it in any retail pharmacy. Like I said, I wouldn't spend more than $25. Let your doctor know that you have one in the home. They're going to love that. That will allow them to manage your disease better. Say, hey doc, I got a pulse oximeter. This is my baseline. Or, I haven't been feeling well this week. My oxygen level is such and such. So great little gadget to have called a pulse oximeter. If you have any questions, post them below. And I'm not sure what next Wellness Wednesday is going to be, but I will leave it at that. And have a great rest of the week. Be healthy, be safe. God bless.